Namaskar. Welcome to Prakash on Basics. I am Prakash Zog. We've seen how the heart works. We've seen the beauty of the way in which the pacemaker cells within the heart help it to pump blood all around our body, and that's how we survive. And all that is controlled by electricity, as I mentioned. But then all that is inside our body. How do we understand what is happening outside? So for that you need to take help of physics and plot a graph which is known as an electrocardiograph, ECG. Sometimes you would find that in US and some countries it will be called as EKG. That's because the original device was manufactured in Germany, and there the tendency was to use the word K for cardio, and so whether it is EKG or ECG, it is still the same. Let's try and understand how all this works out and what are the advantages and what it can tell us. The voltages, the potentials are all inside at our heart, but that potential also reaches the surface of our body on top of our skin. So if we can measure this voltage, then it is possible to get an interpretation of what is happening inside. For this, of course, you need to measure the potentials, which are going to be very small. You need conducting electrodes, and how many electrodes are used in the process will depend upon what type of information you need to gather from the heart. The cells, as I told you, I'm going to repeat some factors because we need to keep abreast of what we are talking of. The cells contain ions, and it is the transition of these ions through the gates that results into potentials, and this typically is known as polarization and depolarization of the cells. Basically, when the muscles are relaxed, it is the polarized state, and when the migration of the ions begins, it results into depolarization, and the voltage changes from minus 90 millivolts to plus 20 millivolts. This is depolarization, and it is because of this depolarization that the muscles would begin to contract, and the process of changing depolarization back to polarization is naturally known as repolarization, and the muscle goes back to its original relaxed state. So this is the cycle how the muscles are working inside. But what's happening is, because of it, certain voltages are the ones which are causing all this effect. Polarization and depolarization together results into what is known as a dipole vector. Vectors are something that is taught in maths, part of physics, and so many other areas. I'll give you an idea about them, and then let's see, it's not really very complicated to grasp. These dipoles are oriented in different directions because of the position of the heart. Now what you need to do is to measure these dipoles in terms of their voltages and find out the time intervals at which all this is happening, and that exactly is what we are really interested in measurement. So what you do is measure the voltages at different locations on the body. So you have a number of electrodes placed on your feet, on your arms, and along the heart on the left side, and a combination of all these electrodes results into various orientations of those dipoles. These are then combined to get the final outcome, and it results into the set of graphs that we talk of. How many electrodes, as I said, depends upon what you want to know. Sometimes all this is connected to a monitor that we see usually with patients in the ICU, and you can actually see the pattern that is produced because of these voltage changes. Ideally, there are supposed to be 12 electrodes. They are placed on the different sequence of patterns. Left side of the chest, there are a group of around 6 of them. There are 1, 2, 3, 4 on your feet and a couple of extra ones. These are all added, and they tend to measure that dipole that I talked of, and the information is converted in terms of the voltage. Realize that the voltage is pretty small, so you don't use a normal voltmeter. It's usually a microvoltmeter, and using vector algebra, it is possible to calculate the exact way in which this wave is formed. So basically you are measuring the electrical activity of the heart and plotting it. So on the y-axis, what you have is the voltage that is plotted in millivolts, obviously, and along the x-axis you have the time, which is in seconds, and that's the graph that you are going to get. How does this graph look? One is the one that you see behind, but let's see. Yeah, that's how an ECG pattern actually looks. The pattern is very similar to the one that you can see behind, which is a simplified version of what is actually happening. You can see a peak, you can see a couple of squiggles, and you can see that the distances between the top peaks are practically constant, and distance in terms of time is the one that represents one heartbeat every time. So that's the type of pattern that you tend to see. How do you connect these electrodes? What you need to do is to use a conducting paste, and the electrodes are then connected to your corresponding unit. The electrical signals are due to the migration of the potassium and the sodium ions in the variety of channels, and that creates a voltage, that creates the dipole. The dipoles are differently oriented, and they are all measured with the help of electrodes, which are given certain voltages if required in terms of positive and negative values. Using a lot of algebra in terms of vectors, these are converted in terms of the values of millivolts and time axis, and what you get is the ECG. Usually the 6 of them are placed below the 4th and the 5th rib, and for simple purposes only 4 more, 2 at these points and 2 on your legs, are used. The voltages will depend upon the requirement of study that is expected. So this is typically referred to as a 12 lead ECG if you are using 12 of them, and for simpler purposes you might use less number of electrodes. And what it measures, as I said, is the dipole wave converted in terms of voltages. Again, as I said, there is constantly polarization and depolarization taking place as your heart is throbbing along. That's what is being measured. Time interval I mentioned last time. It's about 0.8 to 0.833 seconds between the two peaks for a normal systematic behavior pattern. That is the normal sinus rhythm, and it is broken up into parts as you can see on this graph. If that's not clear, I can get a closer one for you, and you can see the pattern that appears. This is just one wave, and this is the one that is constantly repeated. Now what happens? The complete cycle is around 0.833 seconds, or about 0.8 seconds, one peak to the next peak, or if you take a lower point and the next corresponding lower point, it will all work out to be the same. Ideally it should. It's broken up, as you can see, in terms of alphabets into 4 parts: P, Q, R, S, and there is a next wave additionally, which is the T wave. So you have a rise, which is P. It represents the depolarization of the atrium. It takes about 0.1 second. Then that part QRS that you can see behind me is the one which represents the process of depolarization of the ventricles, both of them naturally. And so that's the point typically where higher voltage is required to pump all that blood to your body. But you can't keep on depolarizing every time. It has to relax also. So that relaxation process takes place in a cycle, and so the wave is repolarized. This QRS part is followed by that T part, which represents the repolarization, typically of the ventricle. Actually, the atrium also undergoes repolarization, but that is practically overshadowed by the central large peak. So let's repeat. P is when your atrium, both of them, compress because of depolarization. That's the first part. Then your ventricles compress, and that measurement is given in terms of the QRS part, which takes about 0.4 seconds. And then in another 0.4 seconds the whole system relaxes and comes back to its normal level, and that is the T part, which represents the repolarization of the system. The complete unit as such starts repeating itself, and that's the one that I showed you in terms of the repeated number of cycles. The voltage inside is going from minus 90 millivolts up to plus 20 millivolts, and this is the one that is being plotted all along, and that's what we are seeing. As long as everything is working fine and you are emotionally stable, this is going to result into a normal sinus rhythm. Sometimes you get excited, sometimes you are relaxed, and so the value varies between 60 beats per minute to about 100 beats per minute if you are very excited or running around or doing exercise or something of this sort. All this is said to be normal behavior. But if this sinus rhythm is not correct, if the time factors that I mentioned approximately don't match out, or they shift closer or further away from each other, or there is a mismatch, or if some of the parts are missing, So the wave will be distorted and bad, and that will actually indicate what is happening inside. And this is known as fibrillation. So when you hear the word fibrillation, it means your heart is not really working properly. This can cause stress, because when they are not sequential, they could compress together and create an excessive pressure and a lot of stress and failure and cardiac arrests and so many things. And the problems could get more and more serious. If they go out of hand, then you have to take strict measures. The extreme case that is talked of is to prevent fibrillation, which is known as defibrillation, and that unit is known as a defibrillator. We see that in so many films and so many other areas. They bring two metal rods, put it on your chest, and they give you a big shock, and boom, the person starts working again. Please realize that shock has a different purpose, and it is many times misunderstood. Actually, what has happened is the rhythm has gone bad due to various factors. So what you do is you give a shock and stop the heart, and you expect it to start working normally. So if it doesn't work the first time, then you give him one more shock. So the actually defibrillator stops your heart momentarily, and it triggers on again, and it is expected to start moving in its normal pattern once more. That's what is expected, and that's a defibrillator. That's an extreme case, a serious situation. There could be simpler problems also. When things don't match, or you get old and the signals reaching the various parts are not strong enough, the electrical impulses are weak, sometimes they are not coordinated properly, that could be a problem. What happens is, many a times this beat rate falls below 60, and that's not good, because then the supply of blood is not going to be enough, and it's going to result into blackening and weakness and so many things. This typical situation when the rate is below 60 is commonly referred to as bradycardiac rhythm. And sometimes what happens is, the system goes much higher. It starts exceeding 100, which is within the range. It starts going to 120, 130 and so forth, and constantly it keeps on going higher. That is known as the tachycardiac rhythm, which is higher than 100. So brady is lower than 60 and tachy is higher than 100. But then things can get more complicated. You could have both problems. If there is only one of them, what you do is you give special type of medicines and slow the heart rate down if it is more. These are typically what are known as beta blockers, and you reduce down the rate. Or you reverse the system. If it is too slow, you raise it up by giving suitable drugs. But if it is both and it is irregular, you can't know which one is taking place when, then you're in a fix. The doctor is in a fix, because if he gives medicine to reduce and it is already in the reduced state, it will go very low and the person would have problems. Or if it is high and it gives medication for higher levels, then it goes still higher, and then is a problem again. So these cases are where medication does not really work. So when the system is weak, there isn't enough electrical power available, and when you can't really decide whether to go low or high because of drugs, you need an external factor to control all the space of the heart, and that is the external pacemaker that is put on. And people always talk of pacemakers as this particular part rather than the pacemaker cells that are originally present. So that's the pacemaker. What does it do? It depends upon what it is expected to do. There are three types of pacemakers. Ones that keep on supplying the exact rhythmic value of the voltage directly to the heart. There is a second category which monitors, checks, keeps track of whether things are working right or wrong, and if it falls short or if the signal is weak, it monitors, and if when necessary it provides the additional amount of voltage boost. There is a third possibility. There could be these are more sophisticated, which also have the defibrillators included among them. So if by chance the heart goes out of beat and totally wrong and creates cardiac arrest and things like that, then it defibrillates, it gives a shock, stops the system and triggers it on once more. So there are three possibilities of how pacemakers work. How do you put them? So what you do is you make a cavity here, just in this area, and embed the complete unit inside along with its battery. There are leads that are taken correspondingly to either the atrium or the ventricles, wherever the pulse is to be controlled and connected. So the leads are provided and the battery is inside, and the whole thing is fixed up again and it is left on its own. These are all typically mercury halide, lithium halide batteries, which last, the amount of current requirement is not very high, the voltage is also pretty low, so the batteries could last for around 5 years very easily. What happens after that? So you remove you reoperate, remove and replace the battery once more, and this can go on, and the person would survive for a long time. I know one of my close friends, Professor Kulkarni, has 3 times changed the battery in his pacemaker. So that gives him 15 years of life after his problems. So that's not a very difficult thing to do. There would be better equipment coming up with time, but that's something that we won't talk of just now. Now, think of one more aspect. If I leave the system there and these cells are present, they could result into problems of their own. They have a controlling mechanism of their own. So if you put such a person inside an MRI unit, there could be a problem, because the extremely strong magnetic field inside is going to damage the equipment and may cause trouble in the sequencing of the beats or some other complication. So this has to be prevented. And there is one extreme situation also. Indians, when they pass away, are cremated. So if a person has a pacemaker, we know what restrictions are put on batteries. They would tend to explode when destroyed in fire. So after a person passes away, if he has a pacemaker, it is mandatory that the pacemaker be removed, otherwise it might explode. So there are some restrictions of this sort. But then pacemaker ensures that your life sustains. And realize that it is this pacemaker that has made many people survive in spite of heart problems for many more years than they could have survived. I talked of the ECG. Please realize I have just given you the basics of what it is. You need a lot of practice, a lot of study to analyze the nature of the wave that is present. And from that, you can decide on a lot more aspects related to the heart. So the pacemaker is meant to help you. The defibrillator is also meant to help you. There is another technique that is used, and I might as well mention about it. you must have heard of what is known as the 2D echo that is used to study the heart. What it uses is a Doppler effect, a more complex physics phenomenon associated with piezoelectric effect. It uses ultrasound, and the ultrasonic waves are set within the heart area, and these waves collide and turn back, collide with the RBCs, that is the red blood corpuscles, and are reflected back again, and they are also recorded. And when an object is stationary and a wave bangs and comes back, it is exactly identical. But if this object itself is moving, then the wave hitting and coming back will get modified because of this movement, and that exactly is what Doppler effect is. And so using this Doppler effect, you can decide on the way in which the blood is flowing in the various parts through the various valves, and you can then find out whether movement is correct at the right point or not. If there is a constriction or the restriction, naturally blood will be rushing faster, and so the speed of the flow of blood, which can be measured by using this Doppler effect, you can determine whether it is going too fast or too slow. If the valve is not closing properly, then the flow would be turbulent, and that can also be detected. This backflow is referred to as regurgitation of blood in the various parts. So these are some of the basic problems that people have with their hearts. As long as it works fine, everything is good. It's for us to take care of our heart, not to ensure, not to eat so much of fats that there is an accumulation of fats in our system, damaging and putting pressure on our heart, not to overburden ourselves at the wrong time, and take care of things in general. This is something that is associated with our heart, one of the most important organs of our body. If you have liked whatever I have said, please like and subscribe to this channel. Take care of your heart, because that is equally important. And when you see a patient with a heart problem, realize what sort of problems he must be facing, why he tends to get weak, why he can't walk too much, because there isn't enough blood supply. Take care of all these heart patients, help them out as and when required. Next time we'll look into another area. Let me decide on what to talk on. Till we meet again. Namaskar.